Okay, great. Good morning, everyone. Hi, I'm Ash Alvandi, our Vice President of Orange County. For those of you who don't know me, oversee our work here at OC and our expansion efforts as we're working to support the community more robustly. I think everybody here probably has been working through the weekend, or a lot of us have, on chemical spill. It's a very difficult situation right now for families that have been displaced. We are seeing that the threat of explosion or otherwise is kind of mitigated. That being said, there's still a lot of folks that are looking for services. There's a lot of folks out there that don't know exactly what their rights are and what is available. So appreciate all the work people here have been doing throughout the weekend and otherwise. Special shout out to our legal service teams who put together packets for the community in language, with updated resources. And believe it or not, the laws change every year or two. So there's a lot of research to be done for those things. I'd also like to just start with some housekeeping items, and then we can get to the program, because I know no one's here to hear me speak. But as you walked in, the restrooms are going to be right by the front exit there, so you can just walk out, make rights, and you'll get to that. If you need anything during the panel or program, please feel free to ask any of our folks wearing the AJ SoCal team members. There's plenty of us in the room. I also want to thank our sponsors, Cal State University Fullerton, my alma mater. I'm actually a double Titan, so thank you. Dean Tran here, who's going to be moderating our program, as well as our support from our other community partners that you can see here that have been engaged in this event and have been really leading this space for many years. I also want to thank some of our elected officials. I will say that the Orange County Fire Authority is actually having a situation brief right now, essentially at 10 a.m. So there's a number of folks that are there, and I don't think this list is updated by any means. But perhaps if you are a representative elected official, would you mind standing just so I can kind of say hello, recognize you and your team and your office? We have three executives. We have also Senator Troy, also Senate Member Phil Chen, Councilmember Kyle Chang, and Councilmember Melinda Liu from the City of Irvine. I think I missed one more back there, but hello. Say, oh, hey, how are you? Good to see you. Thanks so much for being here, everybody, today. I will say, this is one of our first real convenings and gatherings in this space. We had our grand opening, which I know many of you were there, but this is something that for our organization is really important because we look at this as a holistic problem. The situation in our communities, the services are not just there to be monolithic. They are supposed to be serving the communities where they are. We rely on research. We do policy work. We do in-language, ethnic community liaisoning and supporting our ethnic enclaves directly so that we know when we deploy our legal services, how and where those services need to be deployed. And this convening, again, is a cross-sector opportunity with researchers from University of California, Irvine, Cal State Fullerton, Center for A3, and our own June Lim from the Asian American Advancing Justice Demographic Research Project. And you're going to hear from her in a moment. But first, I'd like to introduce our CEO, Donnie Savoy, who really, and I think has been 3 months in, has really been taking, back of a letter term, the bull by the horns, because we know right now we are in a moment that needs action. And at AJ SoCal, we know that we have to step up. And the person leading that charge is our own CEO, Donnie Savoy.
Morning, everyone. As Ash said, I'm Donnie Savoy. I'm very proud to say I'm the CEO for Asian Americans Advancing Justice Southern California. Quite a beautiful group we have here today. It's so great to see you all here. Leaders, advocates, researchers, students, and partners gathered today here in this space, our space. What it does is moments like this, for me, really reflect the strength of our community, that we are all coming together. We are in this together. So especially in this new space for us, Orange County, I think this is a very symbolic moment for us as well. At AJ SoCal, our mission has always been rooted in empowering vulnerable communities through the work we do. Legal services, policy advocacy, civic engagement, and community-centered research. I want to pause on that, the research, because that's why we're here today. Because we know and we believe that change really happens when communities are not only supported, but seen and heard and truly understood. And that's why demographic research and data are so critical to that. Data tells stories, compelling stories that often are overlooked or flattened in the conversations around the AAPI communities. There are stories about immigration, of course, health care, health access, housing, education, civic participation, and the incredible diversity that exists within the AAPI communities themselves. A fact that is often overlooked. It is not a monolithic community. There are diverse needs, challenges that we don't often pay enough attention to. So today is especially exciting for us because this gathering, as we said, is one of the first major convenings in this space, in our new space in Orange County. And it was built with this in mind, community, bringing community together. And we hope this continues. This is just the beginning. We want this to be a place where organizations, students, researchers, policymakers, residents can continue to come together to collaborate, learn, have critical conversations, just know more about each other and support one another. That's what this is meant to be. So thank you for kicking this off in this way with us today. As we continue growing at AJ SoCal, we are committed to not only expanding our programs and services, but also the listening to each other, our partners, our clients, all of you here in this room today. And so we know that that's what we need to truly meet the needs of the people that we serve. So with that, I have the pleasure to get this started by introducing our Managing Director of the Demographic Research Project, June Lim. And June will be sharing an overview of some key AAPI demographic trends and also highlighting some of the historic and ongoing research that has helped shape conversations around equity and representation in Orange County and beyond. Good
morning. I'm situated here. So my name is June Lim. I'm the Managing Director of the Demographic Research Project here at AJ SoCal. Hello? Okay, both of my hands. So I'm gonna put the mic back here. So today I'm going to talk a little bit about the demographic data surrounding our Asian American, Native Hawaiian, and Pacific Islander community here in Orange County. Okay, so a little bit about the Demographic Research Project, DRP. We are a strong but mighty team of 3 at AJ SoCal. And really what we do is we use data and research to highlight the great diversity of our A and HPI communities, right? When it's available, we use disaggregated data so that on A and HPI ethnic groups to really tell the stories of and highlight the disparities that exist within the API community. And we make this data and research available for community organizations, policymakers, funders, so that they recognize the needs in our community. Okay, so we're here in Orange County. That's Orange County in the map. The A and HPI community is actually 815,000 A and HPI community members in Orange County. That means we make up 26% of Orange County's population of 3.2 million. The largest Asian American community are the Vietnamese, Chinese, Filipino, Korean, and Asian Indian communities. And among the Native Hawaiian Pacific Islander communities, the largest groups are Native Hawaiians, Samoans, Chamorros, and Tongans. So when we think about the A and HPI community, often we think about it as a community of growth, not only here in Orange County, but across the US. Just for some reference, the Orange County population between 2010 and 2020 as a whole grew by 6%, but the Asian American community in that same time period grew by 33%, and the NHPI community grew by 15%. And some of our AAA and HPI ethnic groups actually grew by more than 50% in that same time period. And that includes like our Malaysian, Chinese, Bangladeshi, Indonesian, Fijian, and Sri Lankan American communities. So where do we live? We live everywhere in Orange County, actually. But this map shows like just the different concentrations by census tracts as to where our communities are concentrated. So the lighter shades of green is like 10 to 25% AAPI, and the darker shades of green is areas where it's actually 55% or more A and HPI communities. And these are the top 5 cities of residence. So Irvine, Garden Grove, Anaheim, Westminster, and Fullerton. And you see this actually reflected in our client population. Our OC clients' top cities of residence include Garden Grove, Westminster, Anaheim, and Irvine. And I did want to pause here with everything going on in Garden Grove to recognize the fact that we know that environmental assaults tend to be most concentrated in poor communities and communities where communities of color reside. So you're going to see Garden Grove come up a lot in my presentation today, and it happened as I was preparing this presentation and hearing about the chemical plant and everything on Friday. It really gave me like food for thought in terms of how to present this data to you today. So please hold that with you as I go through the data. Okay. So just to orient you to these graphs, I have a few of them, and also like looking at the color scheme. You don't have to be able to see what's on here. I will walk you through that. But when I'm looking at the orange, we're talking about the total population for Orange County. The green bars or a green font that I'll be using is for the major racial and Latino ethnic group. And the blue bars are actually signifying the data for the ANHPI ethnic group specifically. So to level set, the 30% of Orange County is immigrant. But when we look at the data, when we break down the data, we see that the majority of Asian Americans, or 56% of Orange County Asian American residents are immigrant, and 16% of NHPIs are. But when we break it down by ethnic groups, we see that there are certain groups, and I only picked out the ones that are higher than the Asian average, are like more than double the rate of percent foreign-born among Taiwanese, Korean, Asian Indian, and Vietnamese Americans. So what does that mean for us, right? In terms of groups with the relatively high naturalization rates, that actually include Vietnamese, Cambodian, Pakistani, and Taiwanese Americans. Given the current moment, I have to talk about this data too, right? 18% or over 38,000 undocumented immigrants here in Orange County are Asian. And several of our ANHPI community members live in mixed status households, meaning they live in a household, right, with family members who are undocumented immigrants, living alongside those who have permanent status or who are citizens. It's no surprise that our immigration and citizenship services are the most sought out services here in Orange County by our clients. So language access needs thread across all areas of our work. They affect access to services, to care, our ability to vote, and our ability to engage in civic participation. 70% of Asian Americans speak a language other than English at home. How many folks here have had to serve as an interpreter, either in their professional or personal capacity? Yeah, there are a lot of us here. And so this data really is to show the percent of limited English proficiency in a population, right? Or we call it LEP, or those who speak English less than very well. Essentially those who can benefit from some language support services. So 18% of Orange County's total population. But when we look at Asian Americans, 1/3 of Asian Americans are limited English profession, 7% of Native Hawaiian and Pacific Islanders. And again, when we look at the data disaggregated, we see that for some of our communities, this need is very high. Over 30% for Taiwanese, Cambodian, Chinese Americans, about half of Vietnamese and Korean Americans. I wanted to highlight some of the work that we do related to this because we recognize this as such a pervasive issue in our community. And that's why we have the Asian Legal Language Intake Project and our community engagement team, where we have like our bilingual staff who can provide services and coordinate with our community members in language. In terms of our policy priorities, we typically always have something related to language access, dual immersion, or bilingual education. And right now, for our primary elections that's happening right now, we make sure through our poll monitoring and legal observation work that language access, our community's language access rights are visible and that they have the material so that they can vote in language. So as you can see here, Asian Americans have a slightly higher rate of poverty than Orange County's total population. And several Asian ethnic groups have lower rates than average, including Asian Indian, Taiwanese, and Native Hawaiians at about 5 to 6%. But many Asian American, Native Hawaiian, Pacific Islander have rates above the average, with Vietnamese communities at the highest rate and at a rate higher than any racial or ethnic group. So the aggregated Asian American figure really masks the fact that some of our Asian American groups experience significant higher rates of poverty. There are also some geographic differences as well. So 15% of Asian Americans and 17% of Native Hawaiian Pacific Islanders in Garden Grove are living in poverty. So this is the same thing, right? Orange is total population, green, race, blue, Asian American, Native Hawaiian ethnic groups. So here we have per capita income, and it goes from highest to lowest from left to right. While Asian Americans, as an aggregate, is close to the Orange County average, about 46,000. At Native Hawaiian Pacific Islanders, per capita income is similar to that of Black residents in Orange County at 35,000. The disaggregated data, though, also show us that there are wide disparities across groups, with many ANHPI groups earning significantly less than the county average. And you see there on the way right, the Vietnamese and Cambodian community, their per capita income is less than half of that of whites, which is 65,000. So this table is kind of a lot. But it's really because I wanted to talk about the high cost of housing. Housing affordability is a big challenge, not only here in Orange County, but in the state and across the US. It is the single largest expense for households, and high housing costs squeeze family budgets, making less money available for other basic necessities such as food, groceries, and health care. The majority of Asian Americans in Orange County own their homes at 60%, and the majority of Native Hawaiian Pacific Islanders also own their homes at 55% home ownership rate. However, that still means a sizable portion of the ANHPI community rent their homes, and more than half are housing cost burden. So the left of each column, the 56% in Orange County is the Asian American rate, so 56%, and 52% is for the NHPI community. And so for housing cost burden, we're talking about 30% of a household income, 30% or more of household income going towards housing related costs. And for severely housing cost burden, we're talking about more than 50% or more going towards housing related costs. So we know that several ANHPI ethnic groups, including Cambodian, Native Hawaiian, Vietnamese, and Taiwanese American renters, have household housing cost burden rates of more than 60%. And these differences, you can find these differences across cities in Orange County. With relatively higher rates of households that are housing cost burden. In Garden Grove and Westminster, you could see that the percentages are higher in these cities. And consider this fact that from 2021 to 2024, the gross median rent in Orange County increased by 19%. And in cities where there are large API communities, it increased by even more. So ranging from 20% increase in Westminster and 25% in Irvine. And between 2023 and 2024, the median gross rent in Garden Grove specifically increased by 11%, while in Orange County as a whole, it increased by 4%. So the relatively higher rates of housing cost burden not only apply to renters, but they also, you see the same trend among mortgage holders as well. That's the end of my data. But really, the key takeaway is this, right? Given its rapid size, its size and its rapid growth, the health and well-being of our Asian American NHPI community is and will continue to be an integral to the county's overall health and well-being. Disaggregated data are necessary to ensure that the disparate needs of the ANHPI community are not rendered invisible and that our most vulnerable are not left behind, especially given the current climate, the growing economic inequities, and growing affordability challenges. So much of the data that I use today can be found at a report that we put out on our Community of Contrast website. The link is here. It'll take you straight to the Orange County data. But if you go to the website, we actually have disaggregated data on our ANHPI communities for all 50 states and specific metro areas in the United States. So thank you.
Thanks, Jude. Great. So next up, we have Priscilla Huang, who's the Executive Director for Center for A3, as I call it. And if you don't know Priscilla is really leading the way on a lot of this research, a lot of this work in Orange County, both in the civic engagement space. But, the presentation she's going to give today, honestly, I'm not sure who would be doing this work if it wasn't Priscilla. So I would love for you all to take that as she walks up here and gives her presentation.
Very generous introduction, Ash. Thank you.
Short too.
Okay.
Welcome. Hi, everyone. Good morning. Again, I'm Priscilla Huang with the Center for Asian Americans in Action. Let me actually preface by saying I'm not a researcher. I'm a policy person. But I think I was invited to join the panel today because, we obviously rely heavily on policy and research to make, data and research to make our policy decisions and inform our advocacy efforts. In particular, many of us in the advocacy world have been closely monitoring what's happening with the federal and state changes to our public health insurance programs, health coverage programs, and the potential impacts that those will have on Asian Americans, Native Hawaiians, and Pacific Islanders in the state and in Orange County specifically. Okay, thank you, Ryan. Yes. So with that, this is where we are right now. So we heard from June's presentation a little bit about the demographic trends and patterns on the health coverage side. We have approximately 1 in 3 Orange County residents enrolled in Medi-Cal, and about over 182,000 Orange County residents also enrolled in Covered California. And I know we don't usually talk about Covered California, but I do want to talk about it in this context because there are big implications for our Asian American communities here in Orange County, which I'll talk about in a moment. So with just a little bit of policy background, but with the enactment of HR1, has everyone heard of HR1? It's the One Big Beautiful Bill Act. Some of us call it the One Big Ugly Bill. But with the enactment of that was last summer, July 4th, you might remember, Many Orange County residents who are enrolled in Medi-Cal and Covered California programs will experience unprecedented reductions in service or cuts in coverage over the next year. And those who are able to maintain their coverage will still experience additional burdensome administrative requirements. So just to talk through, there's a lot in HR 1, but I'm going to focus on two major provisions here that impact our communities in particular. One is the immigrant coverage limits in HR 1. So what that did was it changed the definition of what's called a qualified non-citizen. So essentially it ends the availability of comprehensive Medi-Cal coverage for certain immigrants. It ends the federal matching rate for Medicaid funding for those immigrants. So who are those immigrants? This includes refugees, asylees, victims of human trafficking, and a number of other categories of lawfully present immigrants who have received permission to live and to work in the United States and have traditionally been eligible for full scope Medicaid coverage. HR 1 also prohibits states from receiving an enhanced 90% federal matching rate for emergency services for these same categories of immigrants. In California, we call them UIS, or immigrants with unsatisfactory immigration services. I'm going to use that acronym UIS. But essentially, this loss in the federal funding match will increase financial pressure on our safety net providers and hospitals that provide emergency care to non-citizens. The state estimates over 200,000 Medi-Cal members will no longer qualify for this type of coverage. And on the eligibility and access side, what we're grappling with is starting next summer, starting in January, all states will have to condition their Medicaid eligibility on compliance with work and community engagement requirements. This applies to childless adults ages 19 to 64 who enrolled in the Medicaid expansion group. There are some exemptions, but Cal HHS estimates that 233,000 Medi-Cal members will lose coverage by June 2027, and 1 million will lose their coverage by January of 2028 in California. This comes with 6-month eligibility checks, which means all adults in this category, even those with the exemptions, will have to prove that they continue to be eligible every 6 months. And so the state is estimating that about 2 million Medi-Cal members may lose coverage because of these changes. So what's been the state's response to this? Basically, as we know, we are also facing a budget deficit in California. So in addition to those changes I just mentioned with HR 1, the state is also taking 2 key state actions that will also affect Medi-Cal coverage for people who are deemed to have unsatisfactory immigration status. So basically, the 2 actions are that starting in January this year, January 2026, you might have heard that there was a expansion freeze, meaning mostly undocumented immigrants who are newly eligible can no longer enroll in Medi-Cal. Those with pre-existing comprehensive coverage will continue to be covered so long as they maintain eligibility. And being able to maintain eligibility will also mean that they will have to pay $30 a month of premium, monthly premiums per person to remain eligible. This is starting in July of 2027. And in the May revise that was released by the governor's office earlier this month, they're proposing to increase that to $50 a month per person. So the Legislative Analyst Office, that's the chart on this slide, they're projecting about 1.3 million adults with unsatisfactory immigration status will leave comprehensive Medi-Cal coverage by 2030 due to these state actions. So who are the populations who are at risk? Here in California, this includes everybody in all 3 of our Medi-Cal adult expansion programs. So folks might remember starting in January of 2020, we slowly introduced 3 different adult expansion programs, one for young adults, 19 to 25, one for older adults, which is 50 and above, and then we most recently in 2024 expanded adult coverage to 26 to 49-year-olds. So this allowed individuals who are otherwise eligible for Medi-Cal, except for their immigration status, to be able to enroll in Medi-Cal coverage, regardless of their status. So this has been really important, in particular for Asian American and Native American Pacific Islander communities. On this chart, you can see the statewide enrollment for January 2024 for this middle adult age 26 to 49 category. But the date of implementation, which was January 2024, is about an 8% increase statewide. For AA and APIs, it was threefold. We've seen a 24% increase in Asian Americans and Pacific Islanders who have been able to enroll in Medi-Cal coverage because of this program. Here in Orange County, we suppressed the highest group, enrollment group was Hispanic and Latino. We suppressed that for this one. Whites and Asians were the next highest racial groups, but looking at the disaggregated Asian and Pacific Islander adult categories for this 26 to 49, sorry, that's a typo, group, we see that Vietnamese saw the largest enrollment gains for this group, followed by Chinese and Filipino. We saw kind of a peak in enrollment in the spring of 2025, and then we start to see some drops beginning in December of 2025. The other 2 adult expansion groups for young adults and older adults is much more dramatic, especially for the older adult category for Orange County. So you can see that, again, this is the Medi-Cal expansion, regardless of immigration status, specific to Orange County. The blue line shows the young adult expansion beginning in January 2020, which is when it went into effect. And there's been steady increase since then to January 2026. In the orange line, you'll see that represents the older adult expansion. That's 50 adults 50 years and older. And here in Orange County, we saw quite a dramatic increase in coverage, essentially about 19,000 from May of 2022, which is when that went into effect, all the way to January of 2026. And then when it comes to the Medi-Cal work requirements, we are part of a larger coalition called the OC API Task Force. And we wanted to understand how these new work and community engagement reporting requirements that go into effect in 2027 will impact Orange County residents. So this is an analysis that the OC API Task Force did using enrollment that we were able to receive directly from the Orange County Social Services Agency to create estimates on the number of Medi-Cal members who will be impacted by these, or at least subject to these requirements. So at that time, this was in 2025, the task force estimated that about 60% of adult Medi-Cal members in Orange County, or over 60% of adult Medi-Cal members in Orange County, or over 500,000 of Medi-Cal members, will be subject to these requirements. And you can see it impacts the majority of every racial group in Orange County. This is important to keep in mind because while HR 1 does outline some exemptions, like parents and caretakers and other groups, those exemptions have to be re-verified every 6 months. So that's why even for the Native American, American Indian enrollees, they have a tribal exemption, but they're still going to have to get re-verified every 6 months. And so that increases the risk of disenrollment. So looking ahead, our state budget is not looking too much better. And I mentioned earlier, the governor did release his May revise earlier in the month. It does include some additional proposed state actions that'll impact these populations. And just to talk through them a little bit, the state is now proposing these changes for the next fiscal year's budget, which starts July 1st. One of the better proposals on that first one is it does delay the shift from full scope to restricted scope Medi-Cal for those UIS immigrants until July 2027. So they have an extra those who are already enrolled will have an extra 9 months to use their comprehensive coverage. That allows about 200,000 immigrants, mostly with humanitarian status, to stay on for 9 more months. It proposes to increase the premiums that I mentioned from $30 a month to $50 a month. That becomes really increasingly cost prohibitive for a lot of these families. And then it also is looking to move all state-funded immigrants from managed care delivery to fee-for-service delivery, starting in January 1st. This is actually going to be, I think, going to have a huge impact for counties like ours, Orange County, because we don't have a fee-for-service infrastructure. We haven't had one since the 1990s. We go through CalOptima. It is a managed care delivery structure. And so this will be a huge change for Orange County potentially. And across the state, the estimate is about 2 million members will have to transition from managed care to fee-for-service, meaning they will be on their own to try to find a primary care provider or a specialist, which is incredibly difficult to navigate. So I do want to touch a little bit on Covered California enrollment, just because, again, it's been a critical source of affordable healthcare for many Asian Americans in California and also in Orange County. So here in OC, enrollment in Covered California is highest actually among Asian Americans. So you can see on the chart, 37.2% of Asian Americans of the enrollees here in Orange County are Asian American for Covered California, which is actually higher than the statewide average, which is about 27%. There are a number of policy decisions that have helped to contribute to these coverage gains, including, the state does have its own cost sharing reduction program that was launched in 2024. And the state also has a policy of creating an easier process to transition from Medi-Cal to Covered California that will automatically move individuals who are eligible. And Asian immigrant communities have really benefited from these transitions. So HR 1, when it comes to the impacts on Covered California, what I want to emphasize here is that we are going to see a new restriction also on eligibility for what's called advanced premium tax credits, which are basically federal financial assistance. This is going to end for lawfully present immigrants. The impacted enrollees will include more than 45,000 asylum and pending asylum status seekers and nearly 1,000 individuals remitted as refugees, in addition to 10,000 enrollees with work or student visas. So the impact will be significant here in California, but in particular, it'll be have a disproportionate impact on Asian Americans in California. So this is a slide that was presented during the April Covered California board meeting, where they talk about this transition that's coming up with the ending of the federal subsidies. And you can see here that the enrollees who will lose eligibility for these advanced premium tax credits will disproportionately be Asian American, 70% of them, and about half of those will identify as Chinese. So they comprise half of that group. So here, bringing it back to Orange County, we have especially strong representation among Chinese, Vietnamese, and Korean Covered California enrollees. So this will have a huge impact on those folks. Vietnamese enrollment data in particular is much more pronounced here in Orange County, which is about 13.4% of enrollment versus 2.7 statewide. So we want to pay special attention to our Vietnamese covered California enrollees here. Koreans also represent a higher rate in Orange County versus the state. And I just want to mention Orange County also has a slightly higher concentration of more moderate incomed enrollees. And these are the folks who will not be eligible for that state subsidy. So they will start seeing huge and have already seen huge increases in their premium and out-of-pocket costs. So I'll just end really, with just the key takeaway. I think everyone in this room can appreciate that, what happens in Orange County is incredibly significant because it's a huge indicator to how our Asian American and Pacific Islander communities are doing across the state when it comes to these changes to Medi-Cal and covered California.
Thank you. So appreciate you talking about the intersection between policy, research, data, and how some of this stuff is implemented, because we know that oftentimes folks are looking for more data, more information, how they can pass legislation, do the work in the community. And I want to say I missed a couple folks in the introduction. We have our, where'd Mike Eng go? Formerly Assembly member, the Honorable Mike Eng is here. I think he might have just stepped out. And we also have Representative, our former Mayor, Suki Kang, I think, in the back there. Hey, how you doing, Mayor? Representatives from the Office of Congressmember Dave Min, Mayor of Irvine, Larry Agrin, as well as a representative from Assemblymember Connie Fitchery-Norris' office here. And I think that's important, and it's good that we have some introductions in the middle there, because we often have so many folks in the elected offices looking for data, looking for information from yourselves, and I'm sure they reach out to Dean Gold all the time. And it's really refreshing because we know eyes are on Orange County, whether it's because we're purple, because there's civic engagement, or whether there's need here that is honestly oftentimes invisible. And folks like Dean Gold allow for an opportunity for that data and that information to actually come out of Orange County. And I think he's going to talk about that a little bit today, but I think I'll say the same thing as I said with Priscilla. I'm not sure who would be doing this work, and we know we needed this work. And I'm really grateful for you to spend some time together today and hear from Dean Gold.
Right, let's see if I have any dexterity. There we go. Thank you, Ash. Even though Ash says that he is a proud alum of Fullerton, he has been a very good friend to UC Irvine, and so we appreciate all of your help over the last several years. So I am the dean of the school with the unusual name, the School of Social Ecology. Most of you probably could not define it if I offered you $100 to try to do that, which is fine, because I'm going to give you a very easy way to understand this. We are an interdisciplinary college at the University of California, Irvine, that doesn't just study societal problems, we try to help solve them. And as part of that, in 2023, we created the UCI OC poll. We go into the community 2 to 3, sometimes even 4 times a year to survey what Orange County residents are thinking about big ticket issues. So homelessness, lack of affordable housing, whether people are thinking of leaving the county, immigration. We'll do a poll this summer on whether the American dream is still possible here in Orange County. But we do these polls not as, if you will, entertainment. It's not to be able to give you a statistic. It's to work with community organizations to try to understand what people are thinking about issues, how they affect their lives, what solutions they've considered, what messages might move them, and then also where are the no-go areas, what things just won't work, so that we can then try to implement changes that will improve the community. As I said, we've been doing this since 2023. The simplest way to read our reports is to Google UCI OC poll. It will pop up immediately. So today, I think I've been asked here to come here today to talk about political identity and elections in Orange County as it affects, or I should say, as Asian American communities are affecting those, because there is a story to be told here about the transition of Orange County, and the Asian American communities are really central to that story. Because for any of us of a certain age, and I will not tell you what that age is, let's say it's probably not here in your 20s, Orange County was synonymous for years with the bright red county. It was the it was the red curtain. This was the place that Ronald Reagan said good Republicans went to die. Ronald Reagan won re-election in this county in the 80% level. Well, here we are 40-something years later, and orange is the new purple. That's my idea of America. That line? So when I say orange is the new purple, there are only 3 other large counties in the country that are truly purple. When I say large counties, largest 25 by population, there are only 3 others in the nation that are purple. And let's just see if you've heard me say it before, you don't get to answer. But if you haven't, can you name any of the other 2? You can shout it out. It's okay.
Maricopa.
Which one?
Maricopa.
That's one of them. Maricopa County, Arizona. That's Phoenix. The other one, I've only had one person ever get this one.
Clark County.
No, but it's nice. That would be Nevada, right? That's a nice call. It's Tarrant County, Texas. That's Fort Worth. So it's Tarrant County, Texas, Fort Worth, Maricopa, Phoenix, and us. Now, of those, how many have had television shows and movies written about them? Only us. So we become the example of what a purple county looks like. We're in this moment where the left and the right can't talk to one another. Sometimes they can't be in the same room together. I think they are today, so that's good. But we really have the opportunity to be talking about purple solutions for a divided America. That's another line. It's the last one I have. So when I say we're purple, what do I mean? So the first thing is that when it comes to elections, we typically go back and forth between Republican and Democrat at the top of the ticket. Typically, since 2016, in presidential years, we vote Democratic. In gubernatorial years, we vote Republican. And you'll see the shift here from year to year. But it also means that when we ask people to define their political identity, we're about a third, Democrat, Republican, independent, or no party preference, depending on how you want to look at it. Now, these slides look great on a huge projector in a big room. This is as good as it's going to get. The next, actually 2 slides from now, will be horrible, and as penance, I will walk you through it. But let me at least explain to you what you're looking at here. So the solid numbers are from 2026. The hatched numbers are from 2024. The essential difference from 2026 to 2024 is Democrats went up slightly, they're in blue. Republicans went down slightly, they're in red. And we saw a slight decline in the number of independents. That's within our margin of error. So think of it as roughly still a third, Democrat, Republican, independent. And I should say, this is of registered voters, and that's the entire group I'm going to be talking about today. Now, when we break it down by race and ethnicity, it's also really interesting because we are roughly a third, white, Latino, Asian American. And a note on terminology. When I say Asian American, I am meaning AANHPI, AAPI, or API. We use Asian American for 2 reasons. It is an inclusive term that is then also understood more easily by most of the residents of Orange County, particularly when we have to put 1 or 2 words on a report to explain what is this group that we're talking about. So I am going to be using the expression Asian American. Please understand, I understand all the ways that it could be better phrased, and I hope you will bear with me. So what we're looking at here is this is 2024. So in 2024, again, roughly a third, that's the top line of Orange County adults, a little bit more independents than Democrats than Republicans. But look at the racial and ethnic difference. So white registered voters much more likely to be Republican than anything else. Latino registered voters much more likely to be Democrat than anything else. And Asian American residents, or I should say registered voters, much, much more likely to be no party preference or independence. All right, I'm going to take this off because we need to talk about this next slide. This is 2026. All right, now, what are we looking at here? I'm going to explain it in words and then point to what you're looking at, because this is a mess, but I promise you I'm a great projector. It's terrific. So it is one thing to say Democrat, Republican, Independent. It is another thing to ask people, if you're a Democrat, are you a strong Democrat or are you a modestly attached Democrat? Same thing with Republicans. Independents, when we ask someone, are you independent? That's kind of a misnomer. There are very few people who are truly independent. There are a number of people who say they are independent, but they typically vote Democrat or Republican. So what we have up here is we're trying to show the range of sentiment. So over here, this is overall, this is all Orange County registered voters. And what we're showing is that 20% will say they are strong Democrats. 19% will say they are strong Republicans. Then we have a bunch in the middle. If you add these numbers up, that's 29 and 7, that's 36. 36% of the electorate in 2026 is telling us they're independent, but they're not really independent. What we really have is only 16% of the electorate that is independent. 13% of the people who really say they're independent lean Democrat. 7% say they lean Republican. Why is that important? Because you probably hear from a number of people you talk to, oh, independents are really just frustrated Republicans who don't want to admit that they're really Republican. That is not true in this county. But the big issue to be looking at here is where the Asian American community is and where they are prior in 2024. So this is 2026. In 2026, 36% of Asian American registered voters tell us that they are Democrats. That is a gain of Democrats of 7% over 2024. 26% of Asian American residents tell us they are Republican. That is a loss of 6% for Republicans since 2024. The number in the middle of the independents, that's still roughly the same. It's about 2% less than it used to be in 2024. That's well within the margin of error of our poll. But what's happening in only 2 years is Asian American registered voters are self-identifying more as Democrat than they were before and less as Republican than they were before. And what's really interesting is look at how these communities differ from others. So over here, white residents of Orange County, that is 40% of the white population says that they are Republican. Over here, 26% of the Asian American community says that they are Republican. Latino residents, more likely to be Democrat and independent. On another day, we can talk about where they are moving because they are also in motion across the county. All right, I promise you the next slides are easy. So it's not just whether someone says they are Democrat, Republican, or independent. It's how they'll act on that and how they feel about leaders. So we asked people about their approval rating for President Trump. In Orange County, 62% of registered voters say they do not approve of President Trump's performance. These numbers are from late March. Those numbers have gotten worse nationally for President Trump. They are assuredly worse here in Orange County since that time. But at the end of March, 62% of Orange County residents did not approve of his performance. 64% of Asian American residents said they did not approve of his performance. The group that was most disapproving would not be shocking to you given the immigration rates and where they've been primarily focused, at least in Orange County, the Latino population. Even white residents, white registered voters, a slight difference, more disapproving of President Trump. But in this county, what's been happening, big changes have been among non-white registered voters, moving left or staying left in left center and disapproving of President Trump. Now, I mentioned immigration, and that poll that we did at the end of March, one of the big reasons we did it is we wanted to see where people came down on the issue of immigration. And one of the things we found before we even got there was a really fascinating statistic on the makeup of this county. So June told you that, 56% of the Asian American population here was non-native born. Is that correct? Okay, so that's of people themselves. We asked the question about their parents. All right, so what we're showing over here that's overall. Sorry, I'm gonna have to do this. This is overall. This is 18 to 45-year-old residents. This is 46 or older, white, Latino, Asian American. Blue means that at least one of your parents was US born. Orange means both of your parents were not US born. So what's going on here? What's going on here? First of all, there is a huge age difference. If you are 46 or older, you are more likely to have at least one of your parents US born. If you're 45 or younger, much more likely to have both of your parents born abroad. And what's the group that most explains that? Asian American community. 82% of Asian American registered voters in Orange County report that both of their parents were born abroad. That is a huge, huge number, and it portends a big shift in what's happening here in Orange County, demographically, socially, economically, and politically. All right, so from there, we ask people, what's your view about immigration and immigrants? What you're looking at on the left side is it broken down by political identity. What you're looking at on the right side is broken down by race or ethnicity. So the first question is, does immigration mostly help, or does it mostly not help, or does it mostly hurt, or is it even? 44% of residents in Orange County say immigration mostly helps. Only 27% say it doesn't. About 21% say immigration is evens out. Huge differences by race and ethnicity. So the group where 6 out of 10 respondents tell us that immigration and immigrants are a net benefit Asian Americans in this county. That's this number right there. Contrast that with our other members of the community, white or Latino, who are at least 20 points below Asian American respondents in saying that immigration helps. Compare it also on the question of whether immigration and immigrants hurt the community. Asian American residents, 14%. Right there. Compare it to the 35% of whites who say that immigration or immigrants do not help the community. All right, one more slide. As I said, it is one thing to have these views. It's another thing about how you're going to vote on this and then how you see the various parties. So one of the questions we asked 2 questions that have to do with this. One was, do you approve of how President Trump is handling immigration? And then which party do you think is doing a better job or will do a better job on handling immigration? So I told you before, President Trump's disapproval rating was 62% overall. It is the same number on immigration. So this is something where it is exactly the same. However, when we ask people about which political party is better able to handle the question of immigration, it's roughly even. So the yellow bars are overall. So overall, 34% of residents think the Democrats would do a better job. 32% think the Republicans would do a better job. 24% say there would be no difference. But Asian American residents, 43% think the Democrats will do a better job. Only 28% think the Republicans will do a better job. So one of the questions I get asked is, what am I going to be looking for in the data that come out of the primary election in just a couple weeks? I am going to be very, very interested to see where Asian American voters are going on the candidates, but most importantly, why. And that is what gets me a job. So, I am happy to continue the conversation with any of you either afterwards in the hallway. I know we're going to have a conversation right now that's going to be led by my colleague from Ash's alma mater, but I'm also happy to take emails.
That's a Dave to give me an
You know, where did Dave used to teach?
Yeah, exactly.
And so we're talking about Congressman Min. So Congressman Min used to be a colleague of mine and used to be his boss. But of course, we are very good friends across multiple institutions in this country. Hey, I'm going to be quiet and sit down.
Okay. Yes, we are going to moderate a panel, and I know we're a little bit behind on time, and we're cutting into your networking time, but I appreciate everyone here because I really think this is an amazing conversation with some amazing leaders. And yes, Cal State Fullerton is my alma mater. I did my thesis on quantitative data, so this event is especially important to me. I will say, more importantly, Cal State Fullerton has been a partner for AJ SoCal for many years. About 5 years ago, we worked together on legislation that created a language access program at the university that Dean Tran oversees. And I see Gabriel from the Cal State Fullerton's government relations team here. Wink, wink, that money is sunsetting. So look forward to working with you all on that. But Cal State Fullerton really is an immense partner here. And we know that unlike UCI, Fullerton graduates end up staying in Orange County. So, plus. But an amazing researcher in her own right. I'd love to introduce Dean Tran.
Thank you. Good morning. A lot of love for Cal State Fullerton here, but also want to recognize the wonderful work that our colleagues here at UC Irvine, as well as our community-based organizations. Thank you so much. So if you've heard the amazing presentation, insight, data, and research today, from June, the disaggregation of data to unmask the needs for AAPI population growth, policy from the community in terms of language access, housing affordability, poverty, and then moving into Priscilla's conversation regarding healthcare access for the AAPI communities, intersections between healthcare access, immigration status, and the impact of the changes that both at the federal and at the state levels. And also the impact of John's research regarding big issues, and in this particular example, highlighting the political identity and the AAPI communities and their views on immigration based on race and ethnicity. So, the next segment, I would like to lead us into a more in-depth conversation as the result of the data that were presented. Again, thank you for the wonderful information and the insight. I'd like us to get insights into OC's changing demographics, the community needs, and how to use data to inform policy and enact change, which I believe many of you are here today for that reason. So what is the next step? So what, right? So how can we use the data to transform the work that we do? I'm going to start us off by kind of providing some preview and asking some questions, and please feel free to answer those questions in any way that you think would be helpful. Orange County is often talked about, as you have seen in the data, in broad terms. But the data, as we saw today, tell a much more diverse, layered story about who lives here, how communities are changing, and where the needs are emerging. So the question to start us off with is, what is one demographic or community trend in Orange County that you think leaders who are sitting in this room today and in our community, how our communities are changing and where the needs are emerging? I'm gonna follow up with that question. What is one demographic or community trend in Orange County that you think leaders need to better understand right now, and why does it matter?
So one of the things, I unfortunately didn't have a lot of copies, but some of you might have seen a report out there also from the API task force called Data to Action. And that was done in 2024. But what it revealed, one of the things it revealed was, June talked about the population growth of different Asian subgroups in Orange County and also listed the highest densities by city. We are seeing enormous growth of Asian Americans in outside of those sort of more traditional cities that we think about, like Irvine and Garden. So we're seeing incredible growth in South Orange County, where I live, for example. In the coastal cities, we're seeing a rapidly aging population as well among Asian Americans. So why that matters is because, I think most of us who've been living here understand, there are incredible service providers, resources in some of these more traditional enclaves, but that becomes really difficult to access for these newer growing immigrant communities, particularly in South Orange County. Transportation becomes a huge issue. Language access becomes a big issue. And as a resident of South Orange County, I can say the decision makers, the city council members, the makeup of our local government is very different down there as well. And so there's a lot of extra outreach and support and education that needs to happen at all levels. Thank you, Priscilla. Should I turn it on?
No, it's not.
Now it's on?
Okay. Thank you for sharing that. I did not know that because I have not looked at the latest data. So it's helpful to hear from an actual resident of that area. I think a lot about, I think just on my mind overall, I have been thinking a lot about just affordability issues. Now with Priscilla's presentation related to even health-related costs, we were going to see that go up and the impact that's going to have on the Orange County AMTI community, but also the fact that, the housing-related costs. I'm thinking about the Garden Grove residents. So when I'm thinking about this, I know that's one of the more denser enclaves, but with everything that's happening, will it be safe for them to actually go home? We know that a lot of folks were lifted from the evacuation, but is it actually safe? Or do they feel safe at home? Like knowing that, yes, the imminent risk of an explosion has decreased, but they said it's not gone. And also just the fact that that presence is still there, it doesn't change. But then if they wanted to leave, where can they go? And that's kind of something just not just top of mind for when I think about Orange County, can you just California. Even in my neighborhood, I don't live in Orange County, sorry. But when I see homes come up for sale, I've been seeing that, but at a more rapid rate. And it makes me wonder, are you leaving because you can't afford to be here anymore? So just given the growth of our communities here in Orange County, but knowing that the rising costs of gas, of food, of healthcare, and everything, we know that resources are going to become scarcer. And so how do we make sure that we uplift the needs of our communities, our most vulnerable communities, even the ones that are even far in distance that we might, often forget, and make sure that we are taking care of them too, but also that we're working in collaboration and in partnership with other communities as well in the work that we do, because, the communities that we live in are very diverse. We often live alongside other communities of color. So how do we build those coalitions to make sure that we take care of not only our own communities, but our community at large?
So I'm going to add a slightly different spin on this. There is a huge, huge generational divide in this county. And the cut point is roughly 45, 46. People under the age of 46 on every single issue we have polled on over the last year look as blue as Los Angeles and San Francisco. What makes us purple is people 46 and above. And I think what's largely driving that is some of the affordability issues that you mentioned. At the suggestion of the chair of the Orange County Republican Party, we put a question on the last poll, which was to ask people, do you have a positive or negative view of capitalism? Do you have a positive and negative view of socialism? We did not define either one. We were really looking to see how people thought about this. So capitalism only comes in at positive for about 51% of Orange County residents. That's across the board. Now, socialism only comes in positive about 30%. For people under the age of 35, socialism polls more popularly than does capitalism. Now, put aside all the images we have of youthful zealotry and not understanding what it means to have a job and have to afford things. But my sense is what that is reflecting is a young population in this county that doesn't think that there is necessarily a future for them under the way things are going right now, where they cannot imagine that they're going to be able to afford a house, where they are living at best paycheck to paycheck, and they want something done to make that affordable for them. They are the most likely group to leave Orange County, although Orange County has not been hemorrhaging like other counties. But there is a huge generational divide, and if we don't address the concerns of younger residents, we are going to pay for it down the road.
Thank you. So I'm going to go ahead and piggyback on the context in which you have provided affordability, right? The population changes, the generational divide. So, and in addition to the research that you have seen just now, whether in policy, decisions, funding priority, service delivery, education, language access, or community-based planning, what does that look like for us? What would be the next steps for us?
So,
Done.
The $1,000,000 question. Why? I think that really means, one, using the data that we have for advocacy purposes. But not only the data, but we have to move our community members to also use their voices to advocate for their needs. Because like the data I presented, that's from 2021 ACS data. I know that our communities likely look very different now, but the data that we work with are kind of, they're old by the time we use it, right? So but they're very powerful, but what helps to drive some of the more recent changes is that we need voices from the community. So that's one. I think the other one is in collaboration with partners. We can't do it all alone. So you talked about all the social issues that we work on, but that we can't do it by ourselves. Yes, we provide a wide swath of services, legal services at our organization. But we know we have to work with our partners in Orange County, outside of Orange, up and down the state and across the country to move policies that can uplift the needs of our community. So if anyone wants to add more.
I think one thing that comes, so part of our
advocacy work includes data advocacy. And I don't know if there's anybody from the county here, but there's a number of us who have been trying to work with the county on, it's a state initiative that would unify a bunch of the community health and needs assessments that the county does. I bring this up because there is, yes, we want engagement, right? We want to have a seat at the table to be able to inform and design how this process will look. But the organizations, all of our organizations, especially the direct service providers who have received county and state and city funded contracts over the years, very rarely get to see the data that they actually collect and report. And there's like, I don't know, I have no idea what on the other side. I remember at the federal level, when I went in a meeting, when I used to do federal advocacy, I was in a meeting with ASPE at HHS. I think they said something like 90% of the data collect is never released. So I'm imagining it's probably something similar. There are ways to de-identify that data, but I think my ask for folks who are sitting in policymaking decisions, who have influence with these departments, you know, there are decades worth of utilization data and other forms of data that can be de-identified, that can be released, that are specifically about particular segments of the AA and NHPI community. It's so, you know, this is the reason why we keep talking about we need more data, we need more data. We know it's being collected, but there's not an infrastructure to take a look at that, to analyze it, work with us to release it, for us to even understand what's happening in our own communities.
One of the nice things going third is I get to amplify what you've already said. So it will be no surprise to you that I'm going to be suggesting research. We're a research university. But I suggest it for the following reasons. So most of us have assumptions about the way the world works. There's a line from a former university president that we all think we're great social scientists. We all think we understand why certain groups do certain things, why certain programs operate the way they do. And we're just bad social scientists because we are limited to the network of people that we talk to. And the beauty of research is that it brings in all of the voices and looks at a lot of the different programs. But research that is done the way it used to be done, which is PhDs descend upon site and do research, collect data, and then report it on high and leave, just doesn't work for two reasons. Because one, they don't always get data right. And then second of all, they can't communicate it in a way that the people who participated will understand it. So one of the things our school, I think, does especially well is we do community partnership research. We work with organizations in the community to envision what the research project should be together and then help collect the data together so that we're getting the information that people know to be true on the ground and then work with people on how you disseminate it. So I agree with you that absolutely more data and more research is needed. But here's the other flip side of that. Numbers generally are boring. I mean, I'm excited. But many of us, it's like, okay, I will just gloss over this. The key to presenting data, if you're going to move policy, is that whatever the conclusions are, you need to find the personal stories of people that reflect those broader trends and those conclusions that you're trying to push for. Because stories grab attention and stories move people. But the stories need to be in service of the larger research conclusions and not the other way around. Yeah.
We spoke about voices, advocacy, community collaboration to address the needs. We're going to go to community coalition building, community engagement, and also research that is community-centered in telling a very compelling story to the various stakeholders. So moving ahead and looking at the next 3 to 5 years, what are some of the maybe opportunities or challenges that you see for Orange County when it comes to making sure that our communities are accurately represented, and that we are meaningfully be included in the conversation and the decision-making process, given all the things that you have shared that we should be able to engage in.
3 to 5 years, that puts us at 2029 and 2031. So what I've been thinking about when I'm looking to the future is the fact that the 2030 census is coming upon us. And currently they are doing operations testing for it in a way that is not looking very helpful to our communities. Meaning, one, they're testing it only in English. They're only testing it using an online form, not going, using the paper format. And we know that this is detrimental to many in our community. Also, they are using not the decennial census form, which only takes 10 minutes, does not ask a citizenship question, but they're using the ACS questionnaire, which includes the citizenship question, which is precisely the questionnaire that is used for the data that we use that I presented today. But that takes 40 minutes. And so really, we know that part of that intent is to test possibly the citizenship question for the decennial census. We need the census data. We need our communities to participate, not only for a full count of where we are, who we are, and where we live, but to make sure that we get resources for our cities, our schools, our hospitals, our counties, our state, and for representation. So when I'm thinking about that 3 to 5 years, I see challenges with the census that is going to require a lot of advocacy from a policy level, but also making sure that when it's time to fill out that census, where you live, April 1st, 2030, that our communities are able to complete, and that we move our communities to complete this form so that we can ensure that we get resources for our communities. However, we know that given that trust in the government is also on the decline, and there's a great fear. So for the census, everyone counts, regardless of your status. Everyone counts. So will people we face some challenges during COVID 2020. Always, we have certain communities that are harder to count, and that includes our immigrant and limited English proficient community members. So I know that for us, all of us, many of us were involved with the 2020 census, and that 2030 census is going to be here tomorrow. So that's kind of something top of mind that I know that we'll need to mobilize our community organization partners as well as our community members.
June touched a little bit on distrust of government. And that's something that I'm really concerned about. I know a lot of us in this room are concerned about with the violations, the break in the data sharing, the data sharing agreements between the federal agencies with the states, and data being shared, limited data being shared around Medicaid information, things like that. And that has already exacerbated, I should say. There was already a distrust of government. It has exacerbated that relationship between community members and any government entity. And that will impact, obviously, census results. It impacts everything that we do. I would actually be curious, Dean Gold, if there's perhaps a future survey where we could ask Orange County residents, which forms of government do they actually trust? Federal, state, local, schools, what institutions can we really lean into and do folks consider as trusted sources? Right now, I know this is not a panel about the destruction of our institutions and democracy, but I do think where I do see a lot of hope and a lot of optimism is there are new forms of advocacy that are growing at the grassroots level, very, very grassroots level. And a lot of our organizations, including our nonprofit sector, has been built around a certain framework. And I think I would want to challenge us to, and also our local and state partners, to be creative in how these institutions implement services and operate in ways that are not the usual channels and usual forms.
So funny you should ask that question. We have a poll coming out right around July 4th that will answer some of those questions. So all right, I have two suggestions. So way back when I was earning my political science degree, we were taught, and with no disrespect to the electeds in the room, that the number one thing that motivated an elected official the most was being reelected. So if 56% of the Asian American population in this county is immigrant, the most important thing that can be done is register them to vote, because that's the best way to have a powerful influence. The other thing I would say, though, is that compared to other racial and ethnic groups in Orange County, the immigrant population among the Asian American community here in Orange County is kind of what we would call bimodal. There are a lot who come in highly educated, and then there is many who come in not as highly educated. And I think we can agree that probably one of the biggest drivers of upward mobility still in American society is education. So I think one of the most important things we can do is encourage people to continue their education, ideally at universities, and I think you and I can agree, ideally at public universities in Orange County, right? So whether it's Cal State Fullerton or the University of California, Irvine, forget about Chapman, or community colleges. The most important thing that we can do to help people get a seat at the table is help them get educated.
Thank you to all of our wonderful panelists for the insights that you have provided today. I know we're running short of time. I encourage everyone in this room to continue this conversation with our panelists, with each other, as you think about how can we move this work forward. At this time, I'm going to invite Ash to close us out. Or did I just close that out?